This is Naija Health Education Series. Theme: Eye Care 360 with Dr. Tenman Pamshak Elisha. Raising an informed healthcare community, empowering you with the right information required for making informed healthcare choices. Powered by DAPTV Nigeria with support from Friends of Good Health. Naija Health Education Series. Raising informed healthcare community.
Nice having you again today. We will be discussing childhood cataracts. Cataracts is the commonest cause of blindness worldwide. It's the commonest cause of blindness in Africa and even in our setup. And this cataract itself can affect both adults and children. Therefore, there is a need for us to look into cataract itself, to understand what cataract is all about, to understand how we can reverse this blindness that gets to occur in children as a result of cataract. Cataract is the opacification or the whitening of the crystalline lens that is in the eyes. So the human eye gets to have a lens. This is like the lens which is found in the human eye. When this lens is not transparent, it becomes white. Okay, when this lens is not transparent, it becomes white. And when it becomes white, it doesn't get to allow light to pass through the eye. So when light comes this way, passing through the cornea, coming to meet a white lens which is opaque, it won't allow these rays of light to come all the way to the retina of the patient or of the child, and therefore this tends to affect the vision of the child. And if this is not being addressed urgently for children, then when you even come to do it at a later stage, you will not get the desired result that you are looking for. So therefore, childhood cataract is an emergency for us and needs to be intervened as quickly as possible and as soon as possible. So childhood cataract can be classified into the congenital cataract, the developmental cataract, and then the acquired cataract. The congenital cataract itself is a cataract that a child is being given birth to with from day one. You are giving birth to a child in the hospital, and then this child is coming down with a cataract. So it's defined as a congenital cataract. Developmental cataract is that type of cataract that begins to appear in a child when the child has grown to the age of like 1, 2, 3 years, and then you notice cataracts occurring in the eyes of that child. For the first 1 year of the child is fine, there's no cataract. So that is a developmental cataract. Acquired cataracts are cataracts that the child gets to have as a result of some other factors. So when there are systemic diseases or systemic conditions, they could result into an acquired cataract in the child. When the child has trauma to the eyes, children when they are playing and then something gets to hit the eye, okay, it could result into the development of cataract in that child. Or when the children, when you get to give them medication, steroids, uncontrolled use of steroids, this could result into the development of acquired cataract in these children. So, and then there are so many other causes. It can even occur as a result of another eye surgery that has been done in this child, can result into the development of an acquired cataract in the child. So, but both the congenital, the developmental, and the acquired cataracts, all of them have a similar intervention approach. Now, how do we know that a child has cataract? A child will be known to have cataract if the child has a whitish speck in the eye. That is, when you look at the center of the eye, you get to see a white thing that is in the center of the eye. And that is why we encourage that when children are being given birth to, an eye care personnel needs to have a look at their eyes, need to examine the eye and determine if everything is fine with the eye. If not, then we now begin to offer appropriate intervention. So when you look at the center of the eye of the child, you see a whitish speck at the center of the eye. Now, this can be a cataract, and then it can be also other things that are bigger than cataract. And that is why we cannot just sit down and then watch. Once you notice any abnormality, bring this child to the eye care personnel to examine the eye of the child and to be able to give you assurance and tell you that all is well. Okay, so you begin to see that a mother is breastfeeding a child, and then this child is not having the normal eye-to-eye contact that the mother and the child should have. Now it tells you that this child is probably not seeing. There's a problem with the eye. Or you begin to see that the child is having the eyes deviating. Okay, it's having like a squint, a strabismus, deviation of the eye. So you want to find out what is causing the deviation of this eye of the child. Some of the deviations can occur as a result of refractive errors. Some can occur as a result of cataract. Others can even occur as a result of retinoblastoma, which is the cancer of the eye of the child. So you shouldn't take any deviated eye of a child for granted. These deviations need to be looked at and then to determine and to say that, okay, everything is fine with the eye of this child. Now, some of them could even get to come with their eyes shaking, like dancing eyes. So the eye is just busy oscillating, moving from left to right by himself. Now, it could be that this child is having a cataract in the eyes. So when we get to see the eyes and examine, we'll determine what the problem is and then offer the appropriate intervention for these children. Now, if a child has a cataract in the eyes, it means that an eye care personnel must see, an eye care personnel must intervene. Because if you don't intervene in the cataracts of a child, then it means that this child could get to have blindness, and this blindness can be irreversible. Okay, because if you don't intervene at the time that you're supposed to intervene, because delayed intervention could result into the development of what we call amblyopia. And amblyopia could result as a result of lazy eye. Okay, the eye is there, the eye looks fine, but then the eye is not seeing because of the fact that the eye has not or was not stimulated by light at the younger age when this stimulation should have occurred to the eye of this child. So therefore, we need to pay close attention to the eyes of our children and then to make sure that they don't have eye conditions that we might have neglected because of our ignorance and then making them to present late to the hospital. So when this child is seen in the hospital, we're going to examine the child for the presence of a cataract. If there's a cataract in the eyes, we intervene. And this childhood cataract can occur either in one eye or in both eyes. So when a child is having a cataract in one eye, we must intervene fast. When a child is having cataract in both eyes, we must also intervene fast. Each of these eyes must be allowed to see clearly because there's a period of visual development. There's a period of clear vision sensitivity. If this period is lost, if this period is missed, it now means that the brain is not going to be well stimulated. And when the brain is not well stimulated, when amblyopia develops, even when you get to give these children glasses, you will not be able to get the maximum vision potential that these children are supposed to have. So parents, don't shy away when we tell you that we need to intervene in your child's eye condition. Don't begin to say that this child is too young to undergo surgeries or something. It is the best option that is available for the child that your doctor is discussing with you at that moment. So we'll do our investigations for the child to make sure that the child is fit for surgery, because for cataracts, the definitive intervention for them, both for children and adults, is surgery. The type of surgery might differ, or the method of surgical intervention might differ, but the ultimate intervention is by doing surgeries, and then we insert artificial lens. These artificial lenses are lenses that will remain in the eye of the child forever. We don't need to remove the lens that the child has grown older. No, we keep the lenses there. So what do we get to do? If we get to see this child and then we've made the diagnosis, we've done our investigations, we'll send this child to go do ultrasound scan, that's the scanning of the eye, to be sure that it is only cataract that is in the eye, that this child doesn't have a retinoblastoma, which could be a cancer of the eye for children, which is sitting at the back of the eye. This child doesn't have a retinal detachment or any other comorbidity that will complicate or that will affect the outcome of the surgical intervention of this child. So we need to talk to you, the parents. We need to counsel you, make you understand the fact that this surgery that we're going to be offering for this your child, it is the beginning of our treatment. It is not the end. When we offer you surgical intervention for the cataract, this child is going to be on follow-up with us almost for life. Even when the child becomes an adult, we will now move the child to the adult ophthalmologist, and then they continue the follow-up for these children. Because even the surgical intervention can have its own complications. So we need to follow up so that when those complications that are known and they get to come up, we can offer them intervention that will make sure that the complications don't get to result into blindness or loss of vision in the eyes of this child, so that the child will get to live their full potentials. All right. So what do we get to do? We offer these children surgery, and the surgical intervention, as I said, is the beginning of success for these children. But majority of the things now depends on you parents. When we give you the post-op eye drops to apply for these children, please don't come and say that this child is not allowing me to apply the eye drops. When you don't apply the eye drops as expected, we don't get the level of recovery and improvement that the child needs. After the surgery itself, there might be need for us to also do a refraction and offer these children glasses or spectacles to use. Don't shy away from allowing these children to use their glasses, because when we offer these glasses, it tends to optimize the vision potential and improves the vision for these children. And then we follow them up when we now regulate the frequency of these eye drops that you give, and then the number of times we get to see, and then other interventions that can be done. And then note again, in children, the surgical interventions for their cataract might not be a one-time thing. You might do a cataract surgery for a child now, and then there might be a need to also do another surgery for the child as a result of the first surgery that was done, or to prevent other things that would have occurred. So their surgeries can be more than once. So have an open mind. The most important thing is that your doctor knows what he or she is doing, and then we offer you the best intervention possible, because of the fact that we want this child to have the best vision. So when these children have cataracts, most especially for those that have the cataract in one eye, we expect their surgical intervention to be given within the first 6 weeks of life. Yes, I said it, first 6 weeks of life. Some parents will say, but this child is so small, it's so tiny. How do you want to now start operating this child? You need to operate this child as soon as possible, so that you don't deprive that eye of sensitivity of light and vision, so that the eye will get to see clearly and the eye will get to see perfectly well. When these children have the cataract in the two eyes, then surgical intervention must be done before the first 10 weeks of life, or by the first 10 weeks of life. That surgical intervention must have been offered to the child. Different people believe in carrying that out differently. Some people will do the two eyes for you at the same time. Some people will do one eye first and then do the second eye after 1 week. Depending on your surgeon's preference, we are not talking much into that, but just understand the fact that the two eyes must be operated at about the same time or within a very close space of time. Now, this is because if you don't operate the two eyes at about the same time or within a close interval, that second eye that you left with the cataract without the surgery, when you come and do the surgery very late, the level of visual improvement that you get will not be as good as the one that you get by doing the surgery at about the same time for the two eyes or within the same duration of time. All right. So basically, that is it. So we offer them surgeries. When we offer these children the surgery, we follow them up. So you follow these children up immediately after the surgery. You follow them up 1 week after the surgery, 1 month after the surgery, and so on. Now, this is aimed at ensuring that if there is any complication that is coming up, you intervene to make sure that vision is optimized for these children. And then you also check if there's a need for glasses. We do refraction and offer them glasses. And then we continue to follow up these children. So you get to see that childhood cataract itself, whatever the cause is, intervention needed for them is surgery. So parents, don't shy away from accepting surgical advice for children, because when you don't do that on time, even after we do it later on, they will not get to see well with the eyes. The eye will be deviated, the eye will not be the eye will not be looking straight ahead, because of the fact that you have deprived the brain of proper stimulation when they're supposed to get stimulated and things like that. So congenital cataract, childhood cataract, is a reversible cause of blindness in children. So never shy away from allowing children to have this intervention so that they can live their full potential and enjoy maximum vision. Once again, I am Dr. Tenman Panshak-Elisha, consultant ophthalmologist, your consultant pediatric ophthalmologist. Thank you very much.
This is Naija Health Education Series. Theme: Eye Care 360 with Dr. Tenman Panshak-Elisha. Raising an informed healthcare community, empowering you with the right information required for making informed healthcare choices. Powered by DAPTV Nigeria with support from Friends of Good Health. Naija Health Education Series. Raising informed healthcare community.